Congresswoman Jennifer McClellan. Congresswoman.
Thank you, Katie, and hello, everyone. Thank you for joining us today. As you heard, I'm Congresswoman Jennifer McClellan. I represent Virginia's 4th Congressional District, which is the city of Richmond and its suburbs, the Tri-Cities and its suburbs, and the rural areas down to the North Carolina border. We are here today because once again, the Trump administration and congressional Republicans are raising the cost of living for hardworking Americans in order to pursue their upside down agenda that only benefits the wealthiest top 10%. This time, they're taking food away from working people who rely on SNAP for help with their groceries. Let me start by setting the table. In the last 2 weeks, the Trump administration has put states on notice that SNAP benefits won't be paid in full due to the shutdown. And mind you, this is a shutdown of Republicans' own making because they won't fund the government unless they can rip health insurance away from millions of Americans. And just within the last 2 weeks, President Trump announced a $20 billion bailout for his fellow right wing friend, Javier Milei, the president of Argentina. So instead of coming to the table to negotiate on a budget that lowers the cost of living for Americans, addresses the looming Republican caused healthcare crisis, President Trump is rewarding foreign politicians who say nice things about him to the tune of billions of dollars. Congressional Democrats want to fund the government, and we have repeatedly asked Speaker Mike Johnson for over a month to gavel us back into session so that we can continue working on behalf of the American people. And now SNAP benefits are set to stop, even as the USDA has access to a $6 billion contingency fund that they could tap into to keep them going. And if there's somehow money to bail out right-wing politicians in Argentina during our government shutdown, it's clear we have the resources to ensure that American families don't go hungry on Thanksgiving. And to level set even further, it's the Republicans that cut Medicaid. They're gutting the Affordable Care Act. They're gutting SNAP. And now they're saying they're not going to pay SNAP benefits at all this month. And why are we even in this mess to begin with? Because President Trump and congressional Republicans passed the biggest transfer of wealth in American history through the big ugly law from the bottom 10% of earners to the wealthiest few. All so that billionaires like Jeff Bezos can have enough money to buy another yacht or rent a European city to throw a party in or whatever he does with extra tax breaks he doesn't need. So this is my message to Virginians. We are fighting for you, not billionaires like Jeff Bezos and Elon Musk. We are fighting to ensure that all Virginians can get the care they need when they are sick or injured without going bankrupt. We are fighting to restore Medicaid funding so that hundreds of thousands of Virginians don't lose their health insurance and rural hospitals can stay open. We are fighting for the over hundreds of thousands of Virginians who are about to see their health insurance premiums spike if the Affordable Care Act enhanced premium tax credits expire, and fighting for those who will be forced to choose between paying premiums, putting food on the table, or paying utility bills. And we are fighting for everyone who relies on SNAP to avoid going to bed hungry every night. And that's why I am proud to be here standing with Voices for Virginia's Children and the Commonwealth Institute and calling on the USDA to tap into its contingency fund and for the Trump administration to explore all available resources to keep SNAP benefits going in November. I'm calling on the USDA to provide clear, people-centered guidance to the states so that they can plan accordingly. And I'm calling on Speaker Mike Johnson to come back to work. We have legislation pending that would provide a 3-month contingency fund for the USDA to pay for SNAP, and yet he hasn't called us in for over a month to do anything. Inaction is not an option. Our food banks, our safety net providers are already overwhelmed and undersecured, under-resourced. And I know you're going to be hearing from our food banks on this call. We cannot let this affordability crisis persist any longer. Speaker Johnson and Leader Thune, it is time for you to show leadership, come to the table, and negotiate a bipartisan funding bill that meets the needs of the American people, that addresses the looming healthcare crisis, and ends this shutdown. Thank you, and I'll turn it back over to Katie.
Thank you so much, Congresswoman. Thank you for everything you're doing to help lead this fight. And next, it's my honor to introduce Senator Danica Roem, who has been a champion of fighting hunger for years and also is the vice chair of the Commission to End Hunger. Senator.
Thank you so much, Katie. And Congresswoman McClellan, it's great to see you again. It was such a joy to serve with you in the Virginia General Assembly, and thank you for the work you're doing in the United States House of Representatives. So my name is Danica Roem. I represent Western Prince William County, the city of Manassas Park. And I would like to read to y'all a text I got just yesterday, 401 yesterday, from a constituent of mine from Manassas Park. Is SNAP going to be interrupted in November with the continuing government shutdown? I am terrified for our communities. One of the reasons she might be is maybe this is going to be personal because she has an adult son who is high needs autistic. Maybe it's because she's just a genuinely nice, good, caring person for other people as well. And maybe it's the fact that the SNAP cuts that we're looking at right now are providing, number one, uncertainty to families who need this. And right now they don't know what they're going to do. Our food banks are overwhelmed. I'm going to read to you part of a Prince William Times story. See Evelyn Mejia from my old newspapers on right now. This is not published not too long ago, and this is from about Northern Virginia Food Rescue and how they are facing dire financial straits right now. So to deal with the loss of pandemic ending funding, Franco said she developed a sustainability plan that aimed to reduce cost and secure federal grants and other funding. Franco reduced the size of the warehouse and negotiated a $4,000 monthly savings in rent. Then, earlier this year, the Trump administration froze funding for the emergency food and shelter program provided by the Federal Emergency Management Agency, which the Food Rescue hoped to receive. Quote, none of us were prepared for a lot of the administrative changes that have occurred this year, Franco said. And when private donors are scaling back, when the county's not coming in with as much as they were hoping, they got 20,775 from the county. What happens here when you have a food bank that has already cut back, that has already dealt with this? At this point, it becomes a question of what do they do to continue feeding the most vulnerable people in our community? And when you are dealing with an organization here that provided about 20,000 local school children with weekend backpack foods in 2023, as that Prince William Times stated, it had to cut that number back to $15,000 $15,000 last year, and may have to reduce it again. That's not just a bunch of numbers. These are kids. These are kids in need. And in my district, I'll tell you exactly where they come from. A lot of them come from the 20109 part of the county part of Manassas. They come from a couple of different parts in the city of Manassas specifically, the western end of the city of Manassas Park. And then, yes, to some people's surprise, even in Gainesville, Bristow, and Haymarket, we have very real hunger needs, which is why the Haymarket Regional Food Pantry exists that far in the west in the first place. When SNAP benefits get cut, the first place people turn is the food banks. And if the food banks are underfunded, what happens? They have to turn people away because they don't have anything. So then what do? You have people who are then beginning to subsist on woefully inadequate meals. This is just, by the way, another reason why we need universal free school breakfast and lunch everywhere, period. Last thing I'll just close on here is this is going to long-term, the SNAP cuts that have been proposed, that are through the bill that Congresswoman McClellan mentioned before, that's going to have a very real impact on people eating food. Just to be clear about this. The second thing, though, in the very immediate need, what am I supposed to tell my constituent right now who sent me that text message yesterday asking what's going to happen to the benefits in November? What level of certainty do we have right now? November's coming up in 10 days. I don't have an answer right now because we don't know what the hell Congress is going to do. We don't know what the president's going to do right now. Our families need certainty. We hear all the time about Wall Street needs certainty in order to do blah, blah, blah. Our families who are hungry need certainty. Our families with people who have disabilities need certainty. Our constituents need certainty. That's who we're here to serve.
Thank you so much, Senator, and thank you for your voice as always. And we're lucky today to be joined by a couple of policy experts, advocates doing work in this space. excited to introduce my friend, Emily Moore from Voices for Virginia's Children. Emily.
Thank you, Katie. Good afternoon, and thank you to Congresswoman McClellan and Senator Roem for your continued work to champion food access for Virginia families. My name is Emily Moore. I am a senior policy analyst at Voices for Virginia's Children, the Commonwealth's only multi-issue policy advocacy organization dedicated to advancing public policies that achieve positive and equitable outcomes for all children. We are here today because more than 439,000 Virginia households, including over 300,000 children, are facing the possibility of losing the food assistance that they depend on next month. As you heard from Congresswoman McClellan, on October 10th, USDA informed states that as a result of the federal government shutdown, it does not currently have the funds to cover SNAP benefits for the month of November. Nearly 2/3 of the funds needed for a full month of benefits nationally are available in the SNAP contingency fund, and by law must be used when regular funding for SNAP runs short. USDA has yet to provide states with the guidance or assurance that they need to continue administering SNAP benefits heading into November. This situation is truly unprecedented. Without action, the consequences of this could be devastating. On average, each SNAP household in Virginia receives about $170 per month, money that keeps their families fed and keeps local grocery stores, farmers, and food suppliers afloat. Just one missed month of benefits would mean $144 million in lost food purchasing power and gaps in essential food assistance to families across our Commonwealth. This means that a single parent with 2 kids who just lost their job can't count on those benefits heading into the weeks before Thanksgiving, a time when no parent should have to wonder where their child's next meal will come from. SNAP is one of the most effective anti-poverty programs in our nation's history. It reduces hunger, it supports local economies, and it stabilizes communities in times of crisis. When the government stalls, children and families are who pay the price. And let's be clear, child hunger is a policy choice. The current shutdown, combined with rising food prices and this summer's passage of H.R. 1, which cuts key federal food and nutrition programs, has created a perfect storm, one that increases the risk of hunger for hundreds of thousands of Virginia families and their children. Shutdowns don't just disrupt daily life, but they undermine long-term progress towards reducing child hunger and poverty. Historically, administrations have found ways to sustain SNAP during budget crises and shutdowns by using contingency funds, carryover appropriations, and short-term adjustments. That authority still exists. What's missing right now is the willpower to prioritize families who depend on SNAP to get the nutrition they need. And that is why our call to action is clear. This is not a state issue. USDA must provide clear and actionable guidance to states before November 1st on how to handle SNAP allocations for the month of November. They must use contingency funds to prevent a gap in benefits, and members of Congress must communicate directly with USDA and the administration about the urgency of this issue and must work to identify funding solutions that ensure that there are no gaps in benefits in SNAP for November and beyond. To the families listening today, I want you to know that you're not alone. Advocates across Virginia and the nation are fighting to make sure that SNAP continues without interruption. Your local Department of Social Services agency is doing everything they can to get you the information that they have available. And if you need help, Virginia's food banks and pantries are here to support you. Families should not be left hungry because of political stalemates. Children should not bear the cost of inaction, and the federal government has a responsibility to act now. Thank you, and I'll pass it back to you, Katie.
Thank you so much, Emily. And now we will have Rodrigo Soto from the Commonwealth Institute for Fiscal Analysis. Rodrigo.
Thank you so much, Katie, and thank you for inviting us here today. My name is Rodrigo Soto, and I am the Legislative and Campaigns Director here at the Commonwealth Institute for Fiscal Analysis. Like many on this call, we're here today out of deep concern for the SNAP crisis coming in a few days. The problem started actually earlier this year when Congress passed a reconciliation bill that provides more than $1 trillion in tax handouts to the top 1%. In order to partially pay for that reconciliation bill, Republicans in Congress made the largest cuts to healthcare and food security in history, which includes cutting SNAP by $187 billion. But now the federal government is shut down because President Trump is unwilling to negotiate with congressional leaders on a federal budget that will address the immediate healthcare crisis that is also coming in November the expiration of the enhanced premium tax credits, people will begin to purchase plans and realize their monthly premiums are significantly higher than before. And as a result, approximately 100,000 Virginians are expected to be priced out of their healthcare. But as we shared earlier, due to the current shutdown, USDA's Food and Nutrition Service sent notice to states to announce that benefits would not continue in November if the current government shutdown persists. For Virginia, that means over 850,000 people will lose a critical lifeline based on September data published by the Virginia Department of Social Service. Just to give you a little bit of a snapshot of who we're talking about an estimated 35,000 veterans who live in households that receive SNAP benefits. About 67% of SNAP recipients are in families with children, and those households receive an average of $506 a month in SNAP benefits. And based on 2023 census data, we know that 1 in 3 Black non-Hispanic Virginians live in households that receive SNAP at some point. For Hispanic and Latino Virginians, that number is 1 in 8, and it is 1 in 15 for AAPI Virginians. And no corner of Virginia is safe from interruptions in SNAP benefits. In Central Virginia, over 170,000 people relied on SNAP. For the Eastern region, that number is over 225,000 people. In the Northern region, over 212,000 people are SNAP recipients. In Virginia's Piedmont region, that is over 150,000 people enrolled in SNAP. And lastly, the Western region has over 91,000 SNAP recipients. The impact will be real and devastating as families try to plan for the month of November. Between 2015 and 2019, SNAP lifted 104,000 people, including 42,000 children, above the poverty line per year. Halting benefits will force people to make incredibly difficult decisions in the coming weeks and overwhelm already under-resourced safety net providers like food banks. TCI is proud to join Congresswoman Jennifer McClellan, Senator Danica Roem, and other food access advocates in calling on USDA to use the $6 billion contingency fund to help mitigate the impact of SNAP cuts. Additionally, we're calling on federal leaders to use all available tools to transfer additional funds to the SNAP contingency fund. And based on last month's data, it would cost almost $145 million to cover the SNAP benefits in Virginia, which is not accounting for the administrative costs. But we do know one thing: inaction is not an option as we approach this food crisis. And with that, I'll pass it back to you, Katie.
Thanks so much, Rodrigo. And you spoke to the food banks. It was really important that we center the voices of food banks as well today. So I'm next turning it over to Eddie Oliver from the Federation of Virginia Food Banks. Eddie.
Thank you, Katie. My name is Eddie Oliver. I'm the Executive Director of the Federation of Virginia Food Banks. We work on behalf of all 7 regional Feeding America food banks in the state. Collectively, last year, we distributed over 170 million pounds of food through 1,150 local agency partners, food pantries, soup kitchens, homeless shelters, and an additional 800 distribution partners across every locality in the Commonwealth. We are collectively Virginia's largest charitable response to hunger. We cannot do what we do without strong federal nutrition programs. SNAP, for every meal that food banks distribute, SNAP provides 9. There is simply no way that we can make up significant gaps or losses to that program. Senator Roem spoke very well to the strains that local food pantries are facing. We have seen historically high sustained demand for emergency food assistance over the last 2 years since the end of pandemic era assistance programs. Pantry visits were up 20% across the state last year, and in many regions, current demand is higher than it was at the peak of the pandemic. And that was before policy changes through H.R. 1 have really taken effect, and now we're dealing with this man-made disaster of the government shutdown. Our food banks have been working at near capacity over that period of time, and now we are faced with having to quickly pivot, stand up pop-up distributions to serve federal employees who aren't getting a paycheck. Many of these folks live paycheck to paycheck, and so when one is missed, they quickly have to make difficult decisions about what bills get paid first, and too often food is the thing that's sacrificed. We see parents skipping meals just so their kids can eat. As we commit more resources, dip into reserve funds, surge resources to our pantry network to address the hundreds of thousands of federal employees who aren't getting paid right now, we're now looking at the prospect of SNAP benefits not going out in November. And we completely concur that food insecure families need certainty. There's nothing more anxiety inducing than not knowing where your next meal is coming from, and the impacts on mental health, physical health will be significant if families have to contend with not getting these benefits on time. And we stand ready to help any way we can. As I said, we are surging resources to our network of pantries. We want folks to reach out to a local pantry if you are in need of assistance. But we are certainly not confident that we're going to be able to meet the demand that would occur if SNAP benefits do not go out on time next month. And so we stand with others who call for USDA to deploy these contingency funds, make sure families get the benefits they're entitled to, because food is not optional and families need certainty that they're going to be able to provide for their family. Thank you.
Thank you so much, Eddie. And now we're going to hear from a food pantry. Mr. AJ Young runs one. Mr. Young.
Yes, thank you so much, Katie. It's a pleasure to be on this call. My name is AJ Young, and I am the Director of Outreach for the LifeWorks Project. And we also run the River City Bread Basket, which is a client choice food pantry located in Waynesboro, Virginia. We serve the city of Waynesboro as well as the city of Stanton and Augusta County as a whole. Since June of this year, our pantry has added over 100 new families to the roll to be able to come and shop at our client choice pantry, but also our mobile distribution program that serves seniors and differently able folks. It's important to understand as well that we have served, or we continue to serve regularly, over 500 folks a month, and that number continues to climb. One of the residual effects that I think is very important to bear out here is that we also serve unsheltered folks as well as those that are housed. And because of the work requirements that will now be in place, folks that are unsheltered may not have access to a birth certificate. They may not have access to a social security card. And if you're trying to work, you've got to fill out an I-9, and all of those items that are listed cost money. And so when we talk about food insecurity, there are so many layers that exist within the system. And it is going to be beyond challenging for folks who are coming to our pantry previously just to supplement what they get in terms of food, who will now be completely reliant upon our pantry for food. And so we are grateful for the opportunity to be a part of this conversation. And we certainly hope that the USDA will release the $6 billion that will certainly have an impact in a wonderful way to be able to continue to provide the services that many of our clients have come to rely on in this season. And so thank you. I'll pass it back to Katie.
Thank you so much, Mr. Young. And it's also really important to us that we are centering the voices of folks who are directly impacted by these policies that we're talking about. So next we will have Miss Ariel Robinson, who is from Richmond.
Coming. Hello, can you hear me?
We can hear you.
All right. 1 second. Hi, my name is Ariel Robinson, and I live in Richmond. Thank you so much, Congresswoman McClellan, for having me today. I'm here to call on the federal government to do everything they can to make sure they are protecting SNAP this month for my family and for my 4 children. I have always been a really hard worker. I worked 3 jobs at JCPenney's, nursing, and at Priscilla's, and was splitting $1,600 rent with my mom. We couldn't afford it anymore, so we moved to public housing to save on rent. I recently started a new job at a nursing agency taking care of older folks. And it still just isn't enough to get by, even with SNAP. SNAP ensures my kids can eat healthy food, meat and fruits and snacks, and some things they can cook themselves. Without it, my children would starve. Every dollar is accounted for with all my bills, my rent, my insurance, my phone bill. Whenever I get an extra $20 or $30, it goes to food. I go to Dollar General and try to get noodles, things for like $1.25 to stock up. I was late recertifying my SNAPs this summer, so I know what it's like to go without. I relied on food banks and on my church to feed my children. My church has an after school program that made sure my kids were fed. So if I did not get my benefits in November, I would go to my church and I know they would help me. But I know there are also a lot of other families that they would have to help. So thank you to the Congresswoman McCleany. Excuse me if I'm not pronouncing your name right. And to everyone on this call, please keep fighting for us. Please make sure we get our November benefits. Thank you.
Thank you so much, Ariel, for sharing your story. And next, we're going to turn it over to Audrey Cunningham, who is from Bandy in Tazewell County. Audrey.
Yes, ma'am. Thank you so much for having me. My name's Audrey Cunningham. I live here in Bandy, Virginia, in Tazewell County, with my fiance and our 3 children. Their ages are 3, 4, and 1. My partner and I work doing deliveries for Walmart through a service called Spark, but it's not enough to make ends meet. We rely on SNAP and WIC a lot to feed ourselves, to feed our children. We're also going through a harder time right now because our van broke down. It's in the shop and we can't do any deliveries right now. It's really upsetting that we might not be getting our benefits in November. We are currently looking into food pantries for help. And we're looking at cheaper options for food. We're stocking up on packs of ramen noodles, soups, and canned vegetables. Normally, we don't buy the cheaper foods like ramen because they're not as healthy, but we're really just trying to stock up in case we don't get our SNAP benefits next month. I'm also really worried because if something like this were to happen right now and our van would still be in the shop, we wouldn't be able to make it to the pantries, and that would be and honestly, we're not from here and we don't have friends or family out here really. So that would make things extremely difficult for us. And we really want to get back to doing our deliveries to get money to buy, food, especially if we don't get our SNAP benefits next month in November. We're not going to let our children starve. We're not going to let ourselves starve. We always find a way, but I'm really just asking the government to please fund the program for the month of November so my family and the hundreds and thousands of hardworking Virginia families who rely on this program to help with our groceries. Thank you so much.
Thank you so much, Audrey. And next we will have Ms. Keisha Kane. And Ms. Kane, if you are able to have your camera on, I think there's some Richmond stations that would love to get you. Did she drop off here? All right. Well, I think, oh, I see she's joining right now. So we'll be able to have her give her remarks. Hi, Miss Kate. Can you hear us? I see you're on.
I can hear you. I'm sorry, I was having some technical difficulties.
That's okay. Are
Can
you
you hear
able to
me?
put your camera on?
Yes.
Okay, that
Let-
would be great. And it's your turn whenever you're ready.
Okay. My phone.
It looks like you may have put yourself back on mute. If you can't get your camera on right now, that's okay.
Can you hear me?
Yep.
Okay. Hi, everyone. Sorry. My name is Keisha Kane. I'm speaking today on behalf of my uncle, who is 65 years old. I'm his caregiver, so I'm currently in the process of renewing his SNAP benefits, which come to $291 per month. For over 30 years, my uncle worked as a driver for different moving companies. So it's been a wear and tear on his body, and it's so much that anyone can take moving heavy furniture. So 3 years ago, he had a stroke with it left him unable to work. He's in the process of applying for disability, but that can take a long time. So SNAP has been his only source of income. It at least means he can have food. It's also helpful because he's a diabetic and have certain dietary needs that SNAP can help fill. Therefore, we can just pick the healthier options versus just getting the first thing that we see. We do go to the food bank sometimes, but sometimes that's limited due to the high demand. But we do appreciate that the food bank is also an option. Um, Also, too, it just really makes a difference that he has SNAP to make sure that he has enough food going month to month. Also, I'm an employment specialist at Goodwill, and that's a nonprofit organization. Many of the people who work here, as well as my participants, they use the food banks too to help supply food for their family, when their SNAP benefits aren't going well, or like when they have to recertify and miss deadlines. So I'm just here to not only fight for my uncle and my participants, but for the whole Richmond community. So thank you, Congresswoman McClellan, for fighting for us, as well as everyone else.
All right. Thank you so much, Keisha. And we've got about 8 minutes. I think some folks have a hard stop. So we're just going to prioritize questions from press. If you're a member of the press, since we've got a lot of folks, if you could either drop your question in the chat or raise your hand and I can call on you if you have a question and you're a member of the press.
I'm sorry, Katie. It's been a while since I've done Zoom. I don't know how to raise my hand, but can I
That's
just?
okay, Cam. You have the floor, Cam.
Okay, thank you. I do see on the call, unless he's dropped off here, that we did have the DSS head Kevin Erskine on here. Mr. Erskine, are you able to tell us just what the latest is that your agency has heard from USDA when it comes to SNAP funding and what will be happening next month? And just in case he hasn't doesn't hear me or isn't responding here, I will just ask. I know Governor Youngkin was on Bloomberg News this morning, responding preemptively to this news conference, and I know something whether this could be from Congresswoman McClellan or Senator Roem, basically saying his response is to call Senators Warner and Kane to pass the continuing resolution, the clean CR, to end the government shutdown. Just any response either of you might have to that.
Yeah, I'll take that. First of all, it's not a clean CR. He continues to parrot the, Trump and Republican talking points. It's a CR that would continue to strip healthcare away from millions of Americans, and that would continue the cuts to the SNAP program. It would continue cuts to, senior programs, to veteran programs. So just like we didn't vote for it in March, we didn't vote for the draconian cuts on top of that in July, holding the government hostage and saying that you will only fund the government through November 21st, not even for a full year, not even giving any time to negotiate the 12 appropriation bills that need to be negotiated. The House didn't even hear to negotiate. So what Republicans are asking the Senate to do is continue to allow the Trump administration to traumatize our federal workforce, because they pushed over 200,000 of them off of the rolls before the shutdown began, to continue cuts to health insurance and SNAP programs. And we're not going to do that. We could pass a budget bill that meets the needs of the American people, including preventing millions of them from losing their health insurance when they begin open enrollment on November 1st. They would rather shut down the government than do that. We had a bill that was filed by Congresswoman Amelia Sykes in March that would put 3 months worth of funding in the contingency fund for SNAP benefits. They won't even bring it up in a committee in the House. So, I think Governor Youngkin, as usual, is just cheering on the Trump administration and bowing down to whatever they want to do rather than fighting for Virginians.
Thank you, Congresswoman. And I see Margaret Barthel from WAMU has her hand up.
Yeah, thanks everyone for this call. I wanted to ask specifically about kids, and I know that there are a lot of connections between the SNAP program and SNAP eligibility and school lunches and kids' ability to essentially just be fed in general in Virginia. And I wanted to see kind of if somebody could speak to that impact directly.
I can if no one else wants to. So the SNAP eligibility is used to determine what students and how many students in a school division are eligible for free and reduced lunch. And then the number of free and reduced lunch students are used to find out what schools are eligible to provide free lunch and breakfast. That formula is also used for education funding formulas at the federal and the state level as a proxy for student low income and at-risk students. The big ugly law that passed and all of the changes in eligibility for SNAP is going to reduce SNAP eligibility. The Congressional Budget Office estimates that I think it was 42 million Americans, including about a third of them children, would lose eligibility under that law, which is those changes will begin to take effect a year from now. And so, separate and apart from what's happening with the shutdown, unless Congress reverses the cuts in the big ugly law, you are going to see fewer children who are eligible for SNAP, fewer children who are eligible for free and reduced lunch, fewer school divisions that are able to provide free lunch and breakfast as a result, and you will see less money from the state and the federal government for those school divisions with high numbers of at-risk and low-income students. And that is because of the big ugly law that was passed in July.
If I can just follow up, do we know if there are any concerns about funding for school lunches specifically, or like separate and apart from SNAP or as a result of the shutdown?
Congressman, did you want to handle that? And I'll go second. Okay. So the short version of this is, I think locality school boards have basically been told, like, okay, you start dealing with contingency, funding. They have some funding that can be set aside, and then basically gets reimbursement from that. There is a much more broad long-term problem that comes with SNAP cuts, and basically, because there is a direct enrollment correlation between SNAP and eligibility for the community eligibility provision, which provides universal breakfast and lunch for every single kid in a school division, or in a school, or well, it can be school division, but in a specific school that basically applies, and the waiver is good for 4 years when it happens. The issue that we end up dealing with here is that at a time where we don't have school meal debt in the city of Manassas Park, and at 69 of our 100 schools in Prince William County, long term, this means that if you have fewer students and fewer families who are enrolled in SNAP, that absolutely could affect the threshold rates that schools need for students who are eligible for free and reduced meals in the first place to qualify. And that means that an entire school that has $0 of school meal debt one year could go into 5 figures of school meal debt the next year.
And if I just may add, Margaret, to your question, I think another important piece on the school meals front and the connection here is that many schools need to be able to communicate with their regional offices and the folks at USDA, especially when it comes to making sure that they're getting the reimbursements that they need and they have the technical assistance that they need within their programs. And with employees being furloughed and USDA being restructured in many ways, that is also challenging for our school divisions and our school nutrition departments.
Thank you.
Okay, and I don't think
Oh.
I see any other hands up. Oh, Senator, did you have something?
Yeah, in the chat, Evelyn from Prince William Times, she had asked regarding SNAP recipients in both cities. For all of you who are interested, this is why I'm answering this here instead of just in the chat. Go to the DSS website in the link I just dropped into the chat. The numbers you're going to want to look for on the left side where it says 2025, scroll down to September 2025 report. That's the most up-to-date data that we have by locality of basically, who's enrolled right now.
All right, sounds good. So with that, I want to thank everybody for joining. I know the Commission to End Hunger starts in about 14 minutes, and I know a lot of folks will be joining that as well. So if there's anything else reporters still need for your coverage today, please follow up with me. And thank you to Congresswoman McClellan, Senator Roem, and all our speakers and storytellers for joining us today. Thank you all.